Prior to PACS, we operated in a film-based, paper-based environment and a certain amount of sneaker net technology. In the pre-PACS environment, there were many steps involved in obtaining the images for a patient. Each step required or had inherent time delays, and as a result of all this time that it took to develop the image, present it to the radiologist, it could take as many as 10 to 12 hours to provide the x-ray for the radiologist to read. With PACS, the radiologists are much more efficient. The turnaround time is significantly improved. We now have turnaround times on most studies under 1 hour. The radiologist can be much more productive. Images are available to them immediately upon completion of the examination by the technologist. He or she can be reading the films instantaneously. In addition to that, the referring physicians have immediate access to those images as well as the radiologist from any location, anytime. So anywhere they have network access, they can view these images at the same time we're seeing them. To illustrate the advantages of PACS and the capabilities, this is an example of a case of a CT scan of the spine. And when we obtain these images, we obtain slices through the patient. As we can see here, this is a patient who has metallic hardware placed in the spine. However, with the advanced technology that we have and with the ability of PACS, we can display these images in three-dimensional fashion, where the vertebral bodies are translucent with metallic hardware, or I can even remove the bony structures and only display the metal hardware. So I have an example of a CTA, which is CT angiography of the lower extremities. And again, we've obtained many cross-sectional images through the body. And in this case, there are approximately 2,000 images obtained, which would be almost impossible to display on hard copy film. With PACS, it's very easy to show these in a stacked fashion. And in addition, with the advances in technology, we can take that data and display the same information in a three-dimensional fashion and in color, which there was simply no way to do in a hard copy film environment. It helps with physician satisfaction because they're now able to, number one, get their reports much more quickly because of the enhanced turnaround time, but also they're able to view the images on their patients in a much more timely fashion. To this day, I still have physicians coming up to me 3.5 years later thanking me for implementing PACS here. Physicians now can view these images anytime, any place, any time of the day. They can call me. We can both be looking at the images simultaneously, even if we're not in the same room. I can also consult with my radiologist colleagues. If there's a case that I'd like to review with one of my specialists, I can pick up the phone and he or she and I can be reviewing the images simultaneously from separate locations. So not only does it improve referring physician satisfaction, but radiologist satisfaction as well. In addition, there's potential for decreasing length of stay. Patient doesn't have to be in the hospital as long because they're getting their test results much more quickly. Many patients used to come to the department to sign out their films, and they would have to come to the film library, and the film library would hand them piles of films to take with them. It's much simpler now. We simply burn their images onto a CD, which costs pennies, and they can walk away with a CD which contains all of the images that they've had done. PACS has allowed us much greater flexibility in coverage. We can have a radiologist at one location. This is particularly true on the off-hours shifts, particularly the midnight shift. We can have one radiologist at one site, and he or she can be reading studies from all locations within the Oakwood system. He's constantly reading studies from all the locations on the off-hours. Now we're able to practice real-time radiology.